Hello, my name is Shannon McLam and I'm a nursing student at Fayetteville Tech. This presentation that I have created is on the coronavirus or COVID-19. The purpose of this presentation is to provide information on how to prevent the spread of the novel coronavirus between yourself and your loved ones. So, what is COVID-19? It comes from the coronavirus family, which has a reputation for easily spreading from one person to another. COVID-19 is a new strain from this same coronavirus family. It has never been seen before. Because of this, there are no specific treatments or vaccines for the illness. Symptoms produced by COVID-19 can range from a mild, such as a common cold, to severe, where the patient can experience acute respiratory distress illness and even death. The next important piece of information that you should know about the COVID-19 virus is how does it spread? COVID-19 is known to spread using two main routes. The first and most preferred method for the virus is person to person. This form of transmission occurs when an infected host or person is within about 6 feet from a healthy person. Droplets are naturally expelled when we talk, sneeze, or cough. These droplets in a contaminated individual contain the COVID-19 virus. Once expelled from the infected host, they can enter a healthy host via the oral or nasal passages. The typical incubation period for the COVID-19 virus is between 2 to 14 days, with a median incubation time of 5 to 6 days. This means that it could take anywhere from 2 to 14 days before the virus ever shows the first symptom. Another way that the COVID-19 virus can spread is through contact with contaminated surfaces. The COVID-19 virus can live on hard surfaces such as tables and countertops for days. Here is an example of how this transmission may take place. The infected individual coughed into their hand. Thinking nothing of it, they place their hand on the countertop of the kitchen just beside the sink. That person washes their hands and they walk away. The issue here is that the virus is still alive on the countertop where they placed their hand originally. A second individual walks by and places their hand in the same spot. And then they touch their face. Maybe their nose itched or there's something in their eye. This second person now has a very high likelihood of contracting the COVID-19 virus. So what can you do to protect yourself from this potentially deadly virus? On the next several slides, I will discuss what types of interventions that someone should make in order to stay healthy and prevent the further spread of the COVID-19 novel coronavirus. The best intervention to make when wanting to protect oneself from this virus is to not be around anyone who may have it. Being that the virus can withhold symptoms for up to 14 days, it is virtually impossible to determine who is infected and who is not at only a moment's notice. Even with the newest tests that are being released each day, there is still an average wait period of 2 to 3 days before an official result can be determined. The CDC recommends that all persons stay at least 6 feet apart from one another. This distancing will decrease the likelihood that a respiratory droplet can reach a new host. For those individuals who are at a higher risk for contracting the virus, including those with a compromised immune system, the elderly, the very young, and those with a history of chronic respiratory illness, it is recommended that they do not come into contact with anyone if at all possible. The next tip for maintaining your health and the health of those around you is to practice respiratory hygiene. Respiratory hygiene is when you simply cover your mouth and nose when coughing or sneezing. The CDC recommends that you use a tissue to sneeze or cough into, and then they request that you immediately throw it away and wash your hands. If a tissue is not available, there is an alternative. Coughing or sneezing into your elbow or the sleeve of your shirt is the next best option. A large portion of the respiratory droplets that you would have released will be trapped in either the crease of the elbow or the fabric of your sleeve. Of course, after such action, the CDC will recommend that you wash your hands as soon as possible and limit your contact with anyone and anything until you are able to do so. Cleaning and disinfecting the surfaces that you come in contact with can greatly improve your chances of avoiding the COVID-19 virus. We typically do not make it a habit to cough or sneeze on another person. And the saying is true the other way around, that we typically do not crowd around someone who is sneezing or coughing. We naturally tend to give them a little extra space. But what we often do not think about are the surfaces that we touch. Hard, non-porous surfaces such as countertops, doorknobs, and even our smartphones can host this virus for hours and even days, depending on the circumstance. Properly cleaning surfaces is a big factor in preventing the spread of this deadly virus. The Centers for Disease Control recommend that you use a two-stage cleaning method when trying to rid your surfaces of the COVID-19 virus. The first stage includes cleaning the surface with a detergent or with hot water and soap. Once this dries, they recommend that you use a normal household disinfectant, such as your everyday Lysol or Clorox spray, to disinfect the surface. By following these guidelines, you are increasing not only your safety, but the health of safety of everyone around you and those that you may come into contact with. The last recommendation provided by the Centers for Disease Control is washing your hands. I placed this slide last because it is the most important intervention that you can make while we are in this pandemic. It is recommended that you wash your hands frequently. When doing so, the CDC requests that you use warm water, soap, and lather both hands completely front and back for at least 20 seconds or more. If you are unable to wash your hands using soap and water, the CDC has released guidelines on the proper use of hand sanitizer. They recommend you to use a sanitizer that is comprised of at least 60% alcohol. They would like for you to use enough to cover all sides of your hands and request that you rub your hands together until the solution is dry. There are also appropriate times to use hand sanitizer over hot water and soap. These instances would be if your hands are not visibly soiled, such as if you just touched the countertops that we were mentioning earlier. Simply using a 60% alcohol solution hand sanitizer would be adequate for sanitizing your hands. However, if your hands are visibly soiled with something, hand sanitizer is not enough to fully clean your surface of your hands. The CDC would then recommend that you find somewhere that you could use warm water and soap to lather your hands and wash for at least 20 seconds. On the next slide, I have attached a video from the Centers for Disease Control demonstrating proper hand washing technique. These are only a few of what I felt were the most important recommendations that the CDC and other organizations around the country and the world are releasing. For the most current list of recommendations or the most up-to-date information about the COVID-19 novel coronavirus, please visit the CDC's website at www.cdc.gov. I hope that you are able to learn from this information that I have provided, and please remember to stay safe. Thank you.